So rule number 14, time can be a consideration when choosing which option would be the most appropriate in order to solve the problem posed in a given scenario. So this one is one of the odd rules, and you'll see how it is applied once we do some questions. And we've put actually a couple of questions in here. So let's go on to the first question. You are checking drugs chart on a general medical ward and you notice that the diabetes specialty trainee has prescribed double the dose of a tablet for a patient with diabetes. You are aware that sometimes double the dose of this tablet is given to patients. The patient is stable and the ST is due on the ward in a few hours. Rank in order of the appropriateness of the following actions in response to this situation. Okay, go ahead. So the answer is B, D, E, C, A. So the first option is B, call the ST to check the dose with him. This is pretty straightforward. You are asking the prescribing doctor about why they gave the double dose. There might be a reason, a very good reason, and that might be a learning opportunity for you. And it will show the ST as well that you have picked up this double dose that is not usually given. And as well as if this was potentially an error, you prevent potential harm done to the patient. So it's a win-win-win. And it's a pretty rapid solution to a problem here. So B is your most appropriate answer. Then comes D. Check with the ward pharmacist whether she is aware of the double dosage for this patient. Now, ward pharmacists are aware of inpatient medications given, and even if this was recommended by the ward pharmacist, this still has to be accepted by a senior doctor. So that is why B is more appropriate than D. Now, looking at E, C, and A. So E states that check the dosage with the ST when he comes onto the ward, and we read that it was in a few hours. And C was change the dose to the normal amount given. So E is more appropriate here because you're trying to solve the problem, although it has a time delay here. You are waiting for the ST to come onto the ward rather than giving him the call. And then C states that you change the dose to a normal amount given, so you never really consult the ST who gave the double dose to the patient, and it could be due to a very good reason, but you never try to solve that issue. So that is why C is after E. A is assume the dosage is correct, as you know that sometimes the dose is doubled. This is not correct because if this were to be an error, this could lead to harm to the patient if double dose was given. So you should never assume that and always confirm. Now, it is important in all of these options that each option needs to be seen independently, and then try to answer this question. So you can see the rationale here. You can pause this video and then we'll move on to the next question for rule number 14. Alright, so the next question. A pharmacist approaches you on the ward and queries the dose prescribed to a patient. The dose is twice the normal dosage for that particular drug. You know that the drug was prescribed by the consultant but do not know the reason why. The pharmacist explains that he has seen the dose prescribed at that level for particular cases previously, but wanted to double check as it is quite unusual. The consultant is currently not on the ward. Rank in order the appropriateness of the following actions in response to the situation. Okay, go ahead. Okay, so the answer is A, B, D, C, E. So your first action should be to telephone the consultant to find out the reason why the dose is higher than normal. Again, this will help you with your learning. The consultant may be happy with you that you picked up an unusual dose, as well as if this was an error, you protected the patient from potential harm. So this is your first option, and it's also the most rapid solution here. The second option would be explain to the pharmacist that you don't know why the dose is higher and politely request that he checks with a consultant if he is concerned. So here, although you are solving a problem, you are giving the pharmacist that responsibility to consult with the consultant. Although the pharmacist is will have more information about the drugs and if double dose is a problem or not, the patient is yours. The patient's medical responsibility is yours and your medical team's, not the pharmacist. The fact that the pharmacist highlighted this, it is your responsibility first to address this with the consultant. And that is why A is before B. And the third best answer would be to ask the patient if he knows why he's on a higher dose of the drug than normal. So in a way, you can get the information. However, it is unreliable and it is always best to talk to the prescriber themselves. When we look at C and E, C does not address the issue. You change without having any information. You don't you don't try to consult the consultant first. Again, we have to look at this option independently. So you change the dose to the normal amount given until you're able to discuss it with your consultant, and that might not be anytime soon. So again, time needs to be taken into consideration here, and perhaps the higher dose might be more effective for the patient. But this is still better than C because the double dose might be an error, and without consulting the senior regarding why the double dose was given, this could cause potential harm to the patient, and hence keeping the double dosage without knowing why can be very harmful, and that is why that is the last option. Okay, so this is a long rationale, and I would really advise that you read this properly. Okay, moving on to the next question. You are admitting a patient who does not speak fluent English for an elective operation. He does not have a translator or a relative present. You know from his notes that the patient speaks Urdu. It is apparent that his pain has worsened since his clinic appointment. You ask the patient how long he has been suffering from this pain. The patient appears to understand what you are saying but cannot reply. He is clinically stable. Rank in order the appropriateness of the following actions in response to this situation. Okay, go ahead and answer this question now. Okay, so the answer is A, C, D, E, B. Okay, so let's discuss this. Keeping in mind rule number 14, time to be a consideration. As you saw in the previous questions, we were looking for rapid solutions if appropriate. So here, asking a doctor who speaks Urdu to attempt to communicate with the patient will be the most rapid solution here. You get the job done. You allow a doctor to communicate who will have the appropriate clinical knowledge as well as language skills and will be able to communicate with the patient directly. So the next best answer will be to telephone the NHS language services to obtain a translator. Now, I want you to imagine this. You're trying to take a history from a patient and the NHS language service is present on the phone. You ask a question, you pass on the phone, the translator translates it to the patient, and then the patient replies to the translator, and then the phone is passed back to you, and then so on, so forth, and it's just going to take a whole lot of time. It is appropriate if there was no Urdu speaking doctor there to attempt to communicate with the patient directly, and so the translator will be the next best answer. Because this is their job and they're qualified in doing so, it just takes a little bit of more time. So the next best answer would be D, asking a senior doctor for advice on how to proceed. This is a really good option, asking a senior in case you don't know what to do. But if you do have options A and C there, where you have a solution present, and that's why D is coming after it. So let's look at E and B, right? So E is telephone the patient's next of kin to ask about patient's medical history and symptoms, and B is to continue trying to communicate with a patient to ask about his symptoms. Now although E sounds correct, but there is potential confidentiality that might be broken here. So this is inappropriate. B is also inappropriate because you're going to continue to try to communicate with a patient to ask about his symptoms. Looking at this independently, you're not trying to solve the issue. You're trying to continue to communicate, and you're clearly struggling. So this is the last option. Right, so we will now move on to the rationale.